So this study is a phase 1 clinical trial in patients with chronic graft versus host disease. Chronic graft versus host disease, as we know, is associated with significant morbidity and mortality, particularly in patients who are steroid refractory. And about half of the patients who are treated with steroids for chronic graft versus host disease are refractory to their initial treatment with steroids. And so this study included patients who had failed 2 or more lines of treatment for this disease. And this is a phase 1 clinical trial, and it enrolled 15 patients and reported on safety and efficacy of use of this CSF1 receptor monoclonal antibody in these patients. This study evaluated a patient population where there's only one drug approved so far for treatment, that is ibrutinib. So it's a huge unmet clinical need, and more treatments need to be developed for treatment of these patients. So when we evaluated this patient population, what we saw was that patients had failed multiple lines of treatment. They failed a median of 4 lines of treatment in the past before treating with this CSF1 monoclonal antibody. Patients were enrolled sequentially in a 3+3 treatment design, and 5 cohorts were included. And the first 2 cohorts treated the patients at a dose of less than 1 milligram per kilogram, and then sequentially in increasing doses. The study drug was administered every 2 weeks intravenously in the first 4 cohorts. And then in the last cohort, that is in the 5th cohort, it was